Avoid these 10 deadly garlic mistakes that could ruin your health. Do you have garlic sitting in your kitchen right now? If you're over 60 and you reach for it thinking it's harmless or even helpful, stop for a second. Garlic can be powerful medicine, but it's also a fragile one. The way most people handle it destroys the very compounds they're after, and worse, a few common habits can actually put you in the hospital. I'm going to walk you through 10 deadly garlic mistakes that seniors and caregivers make all the time, and, crucially, exactly how to fix each one so garlic helps you instead of hurting you. This isn't scare talk. These are real mechanisms, documented cases, and simple, practical changes you can make today. Mistake 1. Overcooking garlic, destroying the good stuff. What you do in the pan matters. When garlic is whole, it mostly contains a precursor called olein and a defensive enzyme called alliinase. When you cut or crush garlic, those two meet and create allicin, the active sulfur compound that's often responsible for garlic's health effects. But allicin is fragile. High heat and long cooking times break it down. Why this is dangerous? Overcooking turns a potentially helpful ingredient into plain flavor, or worse, a digestive irritant, without the benefits you expected. For seniors using garlic for blood pressure support, circulation, or general immune benefit, overcooking means losing the reason you used it in the first place. Studies and lab work have shown that the formation of allicin drops sharply with higher temperatures and long cooking times. That's not a promise of cure or prevention, it just means the compound you want is being lost. Simple fix. Chop or crush the garlic, then let it sit for about 10 minutes before you apply heat. That resting time lets the enzyme reaction finish and maximizes allicin formation. After the 10 minutes, add the garlic near the end of cooking on lower heat, or add it to a warm dish off the direct flame. If you want the full raw benefit, include minced garlic in dressings, salsas, or mixed into yogurt or olive oil, paired with food, not on an empty stomach. Short rule: crush, wait 10 minutes, then treat garlic like a medicine, gentle heat, brief exposure. Mini hook: now that you know how to activate it, don't wreck it in the pan. Mistake number 2 is even more common. Mistake 2. Swallowing whole cloves or taking a clove like a pill. You may have heard stories of people swallowing a raw clove every morning like a vitamin. It sounds simple, one clove, no fuss, but it removes the most important step, activation. A whole clove doesn't release much allicin because the inner tissues aren't sufficiently crushed. Worse, raw whole cloves can be highly irritating to the lining of the mouth, throat, and stomach. There are documented case reports where people who chewed or swallowed raw garlic on an empty stomach experienced severe gastric pain and even gastrointestinal bleeding, especially if they already had ulcers or inflammatory bowel disease. Why this is dangerous? You don't get the intended active compound, and you risk damaging delicate tissues. For seniors on blood thinners, even a small mucosal injury can complicate bleeding risk. For people with sensitive stomachs, a raw clove can trigger severe heartburn or worse. Simple fix: always crush or finely chop garlic before you eat it. Mix it into food, stir it into a salad dressing, or mince it into cooked dishes after the 10-minute activation window. If convenience is the goal, consider a commercially prepared aged garlic extract marketed for cardiovascular support, but speak to your clinician first about interactions and appropriate products. Bottom line, don't treat a whole clove like a supplement capsule. Mini hook: you might think pre-peeled is the shortcut. Mistake 3 will show you why that's risky. Mistake 3. Relying on pre-peeled packaged garlic. Pre-peeled garlic is convenient. It's tempting for anyone who hates the smell on their hands or the time it takes to peel bulbs. But convenience comes at a price. Peeled cloves lose protective skin that keeps moisture and microbes out. If the processing or packaging isn't ideal, Pre-peeled garlic can age faster, lose its enzyme activity, and increase the risk of contamination. Jarred garlic in oil, if left at room temperature, can create the conditions where bacteria such as Clostridium species could produce toxins. While such events are rare, older adults and people with weakened immune systems are at higher risk. Why this is dangerous? Loss of active compounds, faster spoilage, and a documented but rare risk of bacterial growth in oil-packed garlic. For seniors, that risk is amplified by age-related changes in immunity and digestion. Simple fix: buy whole bulbs whenever possible. Peel cloves right before you use them. If you must prepare garlic in advance for convenience, do it in small batches and refrigerate immediately. Prepared garlic stored in oil should always be kept in the refrigerator, in clean, airtight containers, and used quickly. Follow the product label, or better, make only what you need for a day or two. Avoid leaving garlic in oil at room temperature. If you use pre-peeled jarred garlic at home, transfer it to the fridge after opening and use it within the recommended period. When in doubt, toss it. Mini hook. Storage choices make a bigger difference than most people realize. Don't make mistake 4. Mistake 4. Storing garlic improperly. Where you store your garlic determines how long it lasts and how safe it is. Whole bulbs want cool, dark, ventilated conditions. Think of a mesh bag or a paper bag in a pantry away from sunlight. Storing bulbs in plastic bags or sealed containers traps moisture and encourages mold and sprouting. Refrigerating whole bulbs can force them to sprout quickly and ruins texture and flavor. Peeled or minced garlic, by contrast, should be refrigerated and used quickly. Why this is dangerous? Improper storage leads to spoilage, mold, sprouting, and, in the case of garlic stored in oil at room temperature, a rare but serious risk of bacterial toxin formation. Spoiled garlic can cause stomach upset, and moldy bulbs can contain irritants. Simple fix: keep whole bulbs in a cool, dark, dry, well-ventilated spot, ideally in mesh, paper, or a ceramic basket. Don't seal them in plastic. Peel cloves only when you need them. For peeled or chopped garlic, refrigerate and use within 24 to 48 hours for best quality and safety. If you store garlic in oil, always refrigerate it and use it quickly. Do not leave homemade garlic in oil at room temperature. Freezing is an option for long-term storage, but frozen garlic has different texture and reduced allicin potential. If you freeze, crush after thawing so the enzyme can act, and expect a loss in fresh flavor. Mini hook: you're protecting it in the pantry, good, but how you eat it matters too. Mistake 5 is something many well-meaning people do at breakfast. Mistake 5: eating raw garlic on an empty stomach. A clove of raw garlic first thing in the morning feels like a natural health ritual for some. But raw garlic is a strong irritant. In healthy people, it might be tolerated, but in those with ulcers, gastritis, inflammatory bowel disease, or reflux, raw garlic on an empty stomach can worsen symptoms and, in documented cases, has been associated with serious gastric bleeding. Seniors on blood-thinning medications are at particular risk if a claim of more is better leads to large amounts of raw garlic added to the diet. Why this is dangerous? It can aggravate mucosal linings and increase bleeding risk in vulnerable people. Even without bleeding, it can cause severe nausea and heartburn, which for older adults leads to dehydration, missed medications, or emergency visits. Simple fix: never eat raw garlic alone on an empty stomach if you have stomach ulcers, a history of gastrointestinal disease, or are prone to reflux. Always pair raw garlic with food, bread, olive oil, yogurt, or a full meal. If raw garlic bothers you, but you still want potential cardiovascular benefits, discuss aged garlic supplements with your clinician as an alternative. Don't make medication changes without talking to a provider. Mid-roll reminder and important early call to action. You're doing great. This is the practical stuff that keeps people out of ERs. Quick recap of the 3 highest risk actions you should address right away. First, If you have upcoming surgery, check surgery-related guidance. Many clinicians advise stopping concentrated garlic supplements and large amounts of raw garlic about 10 days before a procedure, but always confirm with your surgeon or anesthesiologist. Second, check for drug interactions. Garlic can alter the effects of blood thinners, diabetes drugs, and blood pressure medications. And third, never swallow raw garlic on an empty stomach if you have ulcers or inflammatory bowel disease. If you care for someone over 60, hit subscribe now so they don't miss safety alerts like this. Mistake 6. Ignoring drug interactions, assuming natural means safe to mix with meds. This is one of the most dangerous blind spots. Garlic isn't chemically neutral. It can amplify or blunt the effects of certain medications. For people on warfarin or other anticoagulants, garlic, particularly concentrated supplements, has been associated in clinical reports with increased bleeding or more variable clotting times. For people taking antiplatelet drugs like aspirin or clopidogrel, garlic can add to the blood thinning effect. Garlic can also affect blood sugar control. If you're on insulin or sulfonylureas, changes in diet or supplement use can increase the risk of low blood sugar. And for some antihypertensive medications, garlic may modestly enhance blood pressure lowering effects, which could lead to dizziness or low blood pressure. Why this is dangerous? You may think a clove of garlic is harmless, but in combination with prescription drugs, it can change how those drugs behave in your body. In older adults who often take multiple medications, the margin for error is smaller. There are documented case reports and pharmacologic studies showing interactions, but these are associations and signals, not absolute certainties. The right move is to treat garlic like any other active substance you're adding to a routine medication regimen. Start of practical guidance, pause before full detail. Before you add more garlic or start taking garlic supplements, talk to your prescribing clinician or pharmacist. Ask whether garlic could affect your warfarin monitoring, your blood sugar checks, or your blood pressure readings. Pay attention to new bruising, unusual bleeding, unexpected dizziness, or sudden changes in glucose readings if you change your garlic intake. In many cases, clinicians will recommend monitoring and small adjustments rather than stopping essential medications. There are simple steps to protect yourself: testing, timing, and documented product choices, but those depend on your specific meds and medical history. Start by talking with the clinician or pharmacist you trust. Say something like, "I use garlic regularly. Could this change my INR or my blood sugar?" That simple question opens the door to safe monitoring. If you're on warfarin, ask for an INR check after you change how much garlic you're eating or if you start a garlic supplement. If you take insulin or sulfonylureas, tell your diabetes team you've added garlic and ask whether they want extra glucose checks that week. For blood pressure meds, watch for dizziness when standing up and report any sudden lightheadedness. Don't assume natural means inert. Treat garlic the same way you'd treat a new drug until you know how it affects you. Here are some practical ways to reduce risk while keeping the benefits. Prefer culinary garlic in food over concentrated garlic pills unless your clinician has approved a specific product. If you do use supplement, bring the bottle to your appointment so the pharmacist can see the ingredients. Avoid multivitamin blends that hide concentrated garlic without clear dosing. And never add extra raw garlic to your diet in large amounts the week before a planned procedure without telling the surgical team. Mini hook, you've covered medication safety. Now listen carefully to number 7. It's short, direct, and it can make a big difference on the day of an operation. Mistake 7, consuming garlic before surgery, forgetting to tell the surgical team. Surgery changes the rules. What you eat or take in the days leading up to an operation can affect bleeding, anesthesia, and recovery. Garlic, especially in concentrated supplement form or when consumed in large raw quantities, has been documented to increase bleeding tendency in some cases. There are clinical reports of excessive bleeding after dental extractions where patients had been taking herbal supplements, including garlic, or had eaten large amounts of raw garlic. Surgeons and anesthesiologists Commonly advise stopping concentrated garlic supplements and avoiding unusually large amounts of raw garlic before procedures because these products can interfere with clotting. Why this is dangerous. Increased bleeding during or after surgery raises the chance of transfusion, reoperation, infection, and longer recovery times. Older adults are at higher baseline surgical risk, so even small increases in bleeding tendency matter more. Simple fix. Treat garlic supplements and heavy raw garlic use like a medication that could affect your operation. The common clinical guidance is to stop garlic supplements and large amounts of raw garlic about 10 days before a planned procedure. That 10-day window mirrors the lifespan of platelets, the blood cells involved in clotting, and gives the body time to normalize clotting function. But this is a general rule, not a prescription for your case. Tell your surgeon, anesthesiologist, and any other clinician involved in your care that you use garlic, and confirm the stop date with them. If you have an emergency surgery and you've been taking garlic supplements, inform the medical team immediately. Don't hide it. If you're a caregiver, help the patient prepare a list of everything they take: prescription meds, over-the-counter drugs, vitamins, and herbal supplements, and include culinary habits like eats raw garlic daily. A readable list is invaluable for the surgical team and can prevent dangerous surprises in the operating room. Mini hook, surgery checked, now don't skip this next one. A little neglect in the kitchen can let bacteria in where you don't want them. Mistake 8, failing to wash and clean garlic properly. It sounds trivial, but dirt, dust, and microbes live on bulbs harvested from the ground. That papery skin around a bulb is there for a reason. It keeps the cloves protected during storage. Buying bulbs with visible soil isn't a sign of quality. Failing to clean them before use can introduce contaminants into your kitchen. More importantly, when you peel and chop, any surface microbes can move into your prepared garlic products, garlic paste, garlic and oil, or any jarred mixes, where they find a moist environment to grow. Why this is dangerous? For most healthy people, the risk from a little dirt is low, but older adults and those with weakened immune systems are more vulnerable to food-related infections. Improperly handled garlic and oil has been associated with cases of bacterial toxin formation when left unrefrigerated. Even without severe infection, poor hygiene increases the chance of gastrointestinal upset. Simple fix. Always rinse whole heads and individual clothes under cool running water before peeling. Use a small brush if you see soil in the crevices. Dry the cloves or bulb thoroughly before peeling. Bacteria love moisture. When you peel, use clean hands and a clean cutting board and knife. If you're preparing garlic and oil, use only clean utensils, refrigerate immediately, and use within a day or two. Avoid storing peeled cloves at room temperature. If you buy pre-peeled garlic, transfer it to the refrigerator as soon as you open it and follow the label's guidance. When in doubt, discard if it smells off or shows cloudiness or mold. Small steps: rinse, dry, clean tools, refrigerate go a long way for senior safety. Mini hook. You've cleaned it, good, but did you let it wake up properly before cooking? Number 9 is the small trick that makes garlic work. Mistake 9, not allowing garlic to rest after crushing or chopping. This is one of the most important and easiest fixes for getting the benefit from garlic. The chemistry behind garlic's active compound works like this. Intact garlic cells keep together all the chemical pieces separately: an inert sulfur precursor called allene and an enzyme called allinase. When you crush or chop garlic, those two components meet and form allicin, the active sulfur compound often linked to garlic's beneficial effects. But that reaction takes time, usually about 10 minutes to reach a useful level. And then allicin itself is heat-sensitive and fragile. Why this is dangerous. If you skip the resting period and immediately apply high heat, you limit allicin formation and then destroy what little forms. The result? You've added garlic flavor, but you've lost the compound many people are seeking for health. Worse, some cooks add large amounts of raw garlic at the last minute and swallow it in ways that irritate the stomach, so skipping the resting step can contribute to both loss of benefit and increased risk. Simple fix: after you crush or finely chop garlic, set it aside for about 10 minutes before cooking. 10 minutes gives the alliin-alliinase reaction a chance to make allicin. After that waiting period, add the garlic toward the end of a gentle cooking process or mix it into a warm dish off the direct flame. If you use higher heat for a short time, you'll still retain more benefit than if you immediately sear the garlic in a hot pan. For raw preparations, salad dressings, pestos, salsas, mince and rest for 10 minutes before combining with other ingredients. If you plan to freeze garlic, know that freezing can interfere with the enzymatic reaction. Crush after thawing and allow the resting period before cooking when possible. A practical cooking flow you can follow: crush, wait 10 minutes, sauté on low heat briefly, or add to finished warm food. Enjoy. Repeat this simple ritual and you'll preserve much of the chemistry that makes garlic more than just flavor. Mini hook: that rest matters. Now for a final and surprisingly common mistake: choosing the wrong garlic at the store. Mistake 10: choosing poor quality or old garlic. Not all garlic is the same. The variety, freshness, and storage of garlic affect flavor and the balance of the compounds inside. Bulbs with soft spots, green shoots, or black mold mean the garlic has aged and may have reduced potency or off flavors. Sprouted garlic tends to turn bitter and signals that the bulb is past its prime. Importantly for seniors who want consistent, safe benefits, older bulbs may have reduced enzyme activity, which means less allicin even if you crush and rest properly. Why this is dangerous: weak or degraded garlic won't give you the effects you expect. Worse, moldy or damaged bulbs can carry toxins or irritants that upset digestion. Buying poor quality bulbs and storing them incorrectly can turn a once helpful pantry staple into a hazard. Simple fix: choose firm, heavy bulbs with dry, papery skin and no soft patches. Avoid bulbs with green sprouts or visible mold. When possible, buy locally grown or recently harvested garlic from a farmer's market. Freshness matters. If local isn't an option, pick the firmest bulbs at the store and bring them home to a cool, dark, ventilated spot. For seniors who have trouble chewing raw garlic or who dislike the taste, consider alternatives like cooked garlic added late, garlic-infused oil prepared and refrigerated properly, or standardized aged garlic extracts discussed with a clinician. Aged garlic supplements can be gentler on the stomach and may offer a consistent product for people who are intolerant of raw garlic, but always check with your healthcare team before starting any supplement. Mini hook: 10 mistakes covered. Before we wrap up, here are critical warning signs and a short real-world example to keep in mind. A brief real-world illustration: documented cases, not a guarantee. There are short case reports that illustrate why these precautions matter. For example, clinicians have reported instances where patients who ate large amounts of raw garlic or took herbal supplements experienced prolonged bleeding after a dental extraction. In another set of reported cases, people with known gastric ulcers who consumed raw garlic on an empty stomach developed severe stomach pain and, in rare instances, bleeding that required medical attention. A separate example involved a person with inflammatory bowel disease whose symptoms worsened after adding daily raw garlic, contributing to a flare that needed hospital care. These are documented cases that show associations, not proof that garlic will cause the same reaction for everyone, but they highlight the real risks for people with specific vulnerabilities. Warning signs to watch for: unusual or excessive bruising, nosebleeds that are hard to stop, blood in stool or black tarry stools, persistent severe stomach pain, sudden dizziness or fainting, and bleeding from dental or surgical sites that does not stop. If any of these occur, seek medical attention right away. Don't try to self-manage severe bleeding at home. Now, a practical caregiving script you can use. If you care for someone older who uses garlic, here's a short script you can read or adapt when you call their clinician. My parent uses garlic regularly, culinary garlic, and an over-the-counter garlic supplement. They take warfarin or insulin or blood pressure medicine. Should we stop the supplement before their upcoming procedure, and do you want an INR check or extra glucose monitoring after we change their garlic intake? That focused message gets to the point quickly and helps clinicians respond with specific recommendations. Extra practical tips for daily life. If you're cooking for someone who takes blood thinners, don't assume a little flavor is harmless. Keep garlic to normal culinary amounts and avoid concentrated supplements unless the clinician says otherwise. If your loved one has reflux, ulcers, or IBD, avoid raw garlic on an empty stomach and use cooked garlic added after the resting period, or discuss an alternative with the doctor. Keep a visible medication list on the fridge that includes supplements and herbal products labeled garlic. That prevents omission during surgery admissions. For meal prep, prepare small batches of peeled garlic if that helps, but refrigerate and use within 24 to 48 hours. Label containers with the date prepared. Consider alternative forms when raw garlic is not tolerated. Roasted garlic added late in cooking, garlic-infused oil made and refrigerated properly, or clinically studied aged garlic extracts with a doctor's guidance. Recap: 10 fixes you can use today. You've heard the details. Here's a rapid checklist to put on the fridge. These are short, actionable commands you can follow right now. 1. Chop or crush garlic and wait about 10 minutes before heating. This activates allicin. 2. Never swallow whole cloves. Crush or mince them and mix into food. 3. Avoid pre-peeled jarred garlic when possible. If you use it, refrigerate after opening and use quickly. 4. Store whole bulbs in a cool, dark, ventilated spot. Refrigerate only peeled garlic and use within 24 to 48 hours. 5. Don't eat raw garlic on an empty stomach if you have ulcers, reflux, or IBD. Always pair with food. 6. Treat garlic like any active agent. Check for interactions with warfarin, aspirin, clopidogrel, insulin, sulfonylureas, and blood pressure meds. Consult your clinician. 7. Stop concentrated garlic supplements and avoid large amounts of raw garlic about 10 days before surgery. Confirm the timing with your surgical team. 8. Rinse and dry bulbs before peeling. Use clean utensils. Refrigerate garlic and oil and use quickly. 9. Allow garlic to rest about 10 minutes after chopping to maximize active compound formation. Avoid prolonged high heat. 10. Buy firm, fresh bulbs with papery skin. Avoid sprouted, soft, or moldy garlic. Consider aged garlic supplements only under clinician supervision. Final reassurance and what to take away. Garlic can be a powerful addition to your diet when handled correctly. Think of it as nature's pharmacy that needs a careful pharmacist's approach. Small, simple changes, crushing and waiting, storing properly, checking with your clinician, and pausing before surgery turn garlic from a risky habit into a safe, useful tool. You don't have to give it up to be safe. You just need to treat it with the respect you'd give any active substance. If you take medications, have digestive disease, or are headed for surgery, mention your garlic habit at your next doctor's visit. If you care for someone older, help them adopt these fixes. Small adjustments now prevent emergencies later. Which one of these 10 mistakes surprised you the most? Tell me in the comments which garlic habit you'll change first, and share this video with an older family member or caregiver who needs to hear it. If you found this helpful, like and subscribe for more practical, evidence-minded tips to keep seniors safe and well.